Nemolizumab showed a favorable long-term safety profile, with most adverse events being mild or moderate and consistent with earlier trials. Infections were the most common adverse events, and herpes infections with about 6.3%, while generally mild and manageable, warrant routine clinical awareness. Peripheral edema occurred in a small proportion of patients, about 1.8%, and was usually mild, though some cases led to treatment discontinuation. Asthma and respiratory events were also observed but remained infrequent and mostly non-serious. Overall, no new safety signals emerged, but clinicians should monitor infections, edema, and respiratory symptoms, as well as other events during long-term treatment. At the start of the long-term extension, patients with prior nemolizumab exposure had higher rates of IgA 0/1, EASI-75, and itch and sleep improvement. Nemolizumab-naive patients entered the study with more active disease and lower rates of IgA 0/1, EASI-75, and itch and sleep improvement. However, both groups improved steadily with continued treatment. Approximately by week 20 and up to week 104, outcomes for naive and previously exposed patients were closely aligned across skin, itch, sleep, and quality of life measures. This demonstrates that patients starting nemolizumab de novo can achieve comparable results rapidly and maintain over long term. Nemolizumab uniquely targets the IL-31 pathway, a central driver of neuroimmune regulation in atopic dermatitis. This mechanism leads to rapid antipruritic effects, with improvements seen as early as week 1 in earlier trials and sustained through 2 years with efficient skin relief. In contrast, dupilumab, lebrikizumab, and tralokinumab inhibit the IL-4/13 axis, primarily reducing type 2 inflammation. Those agents have recognized associations with ocular surface disease, whereas no ocular safety signal has been observed with nemolizumab in long-term data. This positions nemolizumab as a strong option for patients with itch-dominant disease or those at risk of ocular complications like conjunctivitis. The 2-year data show that nemolizumab provides durable skin clearance, robust and sustained itch and sleep improvement, and meaningful quality of life benefits. Its long-term safety profile remained stable with low rates of discontinuation due to adverse events. Clinical responses were strong across both naive and previously treated patients, supporting its consistency and reliability in long-term AD management. These findings position IL-31 inhibition as an important therapeutic strategy for patients needing sustained control, particularly those with severe itch. Looking ahead, further extended long-term extension results, real-world evidence, and biomarker-driven patient profiling will further refine the role of nemolizumab in atopic dermatitis care.